Good morning, Camden County. I'm here at the new health department for the county, and I'm also here with Robbie Horton, the city manager for St. Mary's. Looking forward to kind of giving you all a sneak peek.
I haven't been here before, so this is going to be news to me as well. But this is exciting for Camden County as a whole. It unifies all the health departments all across the county and brings them all in, brings public health as a whole in one location.
Right.
So all the septic tanks, the kitchens, and all that stuff that the environmental side does is in the same location, right?
That's right. So we've got 3 different sites right now for DPH, Department of Public Health. There's one in Woodbine, that's the clinical side.
Right.
And then we have the other clinical side down in St. Mary's, as you know. And then we have the environmental side at our annex right off of Gross Road, off of Highway 40 and Gross Road. So this building is a 12,500 square foot facility, right over $6 million in total. $3 million of that is coming out of SPLOST 8. So quite a bit of contributions from our local taxpayers and even some of our tourists that come through the communities. But you know, what we want to do today is just kind of do a sneak peek, if you will. So we're about, right out about a month away from doing a ribbon cutting on this facility, but felt like it'd be a good opportunity for us to show to citizens exactly what SPLOST dollars are actually going towards. So,
and we're it's located right here at the hospital on Winding Road. That was the placement of it close to all the, kind of creating a health mecca, if you would, for Camden County as a whole. So the location is outstanding as in placement.
You talk about community collaboration, and we got such a great partnership with Southeast Georgia Health System. They actually donated the property. So very, very fortunate to be able to collaborate with the hospital. We're very, very thankful for the partnerships that we have. So with that, what we'll do is we'll just kind of transition and show you all some of the features of the facility, where offices are actually going to be.
I'm excited about it,
and it'll be pretty awesome. So
I want to see it. I really do.
So just over here to my left is actually where the new environmental health facility is going to be. So this is where you'll come in if you've got any business application like a restaurant or anything like that. You'll come in here to the lobby and check in, set up your appointments, meet with staff, do whatever you may need to do. Continuing through, and I don't know if they're able to see this, but this is the entire wing of the environmental health side. So we've got a number of offices to more than accommodate.
The environmental, that's the one that does the septic tanks and has the restaurants and all that stuff that are involved in.
Septic tanks, restaurants, rabies, even mosquito checking. They do all kinds of stuff. It's pretty impressive what they do. So just to our right here is the lab, where they'll do quite a bit of their testing. They'll have storage, different capabilities with this room. Really awesome.
They've got plenty of room with it. That's
to be able to expand. Absolutely. So this expansion is probably 2 times what they currently have.
Wow.
Which will more than assist them into the future.
That's cool.
So let's go check out the rest of environmental health. Show you a couple offices, and then we'll transition into the Department of Public Health side, the actual clinical side. So we have staff restrooms. These are just a few offices for the staff. And transitioning now, we're going to actually go over to our clinical side, and I think you're really going to be impressed with this facility. And as we move forward, we got a fitness room here, which is really cool, something new. We have a smaller one of these, but this will be a much larger room for us to actually be able to operate in. When you come into this room, it's massive. You've got all of these stations to more than accommodate the citizens as they come in. They check in with the nurses, get their vaccinations, WIC program, women, infants, children, anything that they need to do through the Department of Public Health, the clinical side. This is where they would actually check in. The nurses would be behind the counter, the clerks. And then what's really cool about this room, really impressive actually, is our file storage room.
Wow, look at the size of that.
The file storage room is probably one of the largest file storage rooms that I've ever seen, at least in this county. We've got 12 of these massive file storage rooms, or file storage cabinets, if you will, and pretty impressive. I think they're about 9 feet tall, maybe 8. I think they're probably 8 feet tall.
Yeah.
But really, really seamless transitions. Very, very smooth operation. If you look at the capacity of these things and how deep they are, I don't know how long it's going to take us to fill it up, but hopefully a long time.
Well, when you start thinking about medical records and things of that nature and how long you've got to keep them, that,
Right.
you know, it's going to be.
Very impressive storage facility. I will say one thing about this facility is that the amount of storage that we have is amazing.
Yeah.
So on top of this storage room, this is all for files, but we even have another storage room for just, you know, paperwork, different things.
Yeah.
As we continue going, you have your clerical manager's office here. And guess what?
More storage.
We got more storage
More storage.
right here.
That works.
Much more storage. So really nice cabinetry.
Yeah.
So very fortunate for that. For our mothers, we have breastfeeding rooms. We also have an immunization room. And if you'll look down this hallway, we have more than enough exam rooms
Yeah.
to accommodate pretty much anything and everything
Yeah.
that we'll need
And
for the
it's
future.
interesting that I've noticed that on the signs that the segregation of it is, and that's, I like that. I really do.
Yeah, we even did like an offset of the colors, so you'll see different color patterns, which kind of breaks the hallway up,
Yeah.
makes it look a little bit more inviting and
Yeah.
friendly. So very, very fortunate.
And don't
for that.
forget the storage.
Yeah, more storage. So we got more storage. So these are just different offices. This is one of the WIC offices, Women, Infant, Children offices, where they'll come in, do their exams with the nurses, meet with staff. And as we continue down, we'll actually get into some of the exam rooms. This is where DPH will actually do a lot of their urinalysis testing. And then from here, they have their lab. And the lab, so the cool thing about the lab, and most clinics have these now, but this actually connects over to
To the door.
restroom. So
Yeah. So when you do your,
right, so that way whenever they do
Yeah.
their urinalysis, the nurses are in here, they grab it, do their testing.
maintain the privacy.
That's
do what
right,
you gotta
maintain
do.
privacy.
There you go. And I also noticed that with the doors and everything, and it being a health building, you met ADA requirements.
Absolutely, yeah. And guess what?
We got storage.
We got more storage. Storage is great. So we also have an internal pharmacy for the nurses and their staff, just so they can hand out any prescriptions that they need to right
Yeah.
here at the same facility. Keyed, entry, so that way everything's locked down, safe, everything's maintaining compliance. Just to kind of show you one of our exam rooms, again,
Good side of the room.
went with different color patterns, so kind of breaks everything up, makes it more inviting. You've got your standard cabinetry here. Every one of these cabinets actually has under lighting. This one isn't on right now, but every one of them has a sink, more than enough storage cabinet space to house any kind of prescriptions or syringes or whatever
Yeah.
they need to be able to do their exams.
Yeah, typical medical.
Transitioning in, so this is where probably the large part of the work gets done through our nurses. This is actually their nursing room where their offices will be held. You can see the under lights here up under the cabinets. These are on,
It's
but
good use of space.
each of these they're not cubicles, but each of these little
Yeah, workstation.
workstations, if you will house more than enough for our current staff as we have, and even additional. And again, more storage. I mean, just
Yeah.
the amount of storage and capacity that we have here with this facility is really amazing.
Well, it takes a lot of paperwork. Too.
It does. It does.
Medical field side of it.
This building is just really deceiving. I mean, as you look at it from the road, it looks small, but as you walk through it, it just opens up.
It's everywhere you turn, you go a different direction, and then find yourself back where you started from.
That's
So to
right.
speak.
More storage. So another storage room. We've got more another WIC exam room, and then this is kind of where the managers' offices are. So you got a nurse practitioner, nurse manager. They'll have their own offices.
Wow.
And then we will finally finish out with a large break room, kitchen, meeting room. Really nice facility here for
Wow.
anytime they do their
Look at that
regional
view.
meetings. Yeah, beautiful view, landscape there.
Yeah.
We'll have TVs on the wall so they can do any kind of teleconferencing, presentations, anything like that. They also have pretty much their kitchen here, any type of you know, breaks that they need to take. So
Yeah.
more than enough room for them to flex out versus what they have now.
Well, and it's bringing them
Yeah.
into the more modern age of things as well, and that's critical.
Yeah, this will be one of the nicest facilities that the county actually has. So very, very thankful to the voters who approved SPLOST State. Very fortunate for that. And this is just one of the benefits that we've actually been able to have from SPLOST. So very, very fortunate. And we'll probably be looking at doing a ribbon cutting on this facility sometime in April.
Yeah, I mean, they're going through the last steps. You can see the little blue tape here, there, and
Right.
oh, we got to fix that. We got to fix. So
Yep.
it's
Just a few more things, a little bit more paving, a little bit more, you know, touch-up work, plumbing.
Yeah.
And from there, we'll be putting in furniture and putting in computers, and we'll be ready to go.
It's going to be awesome.
Yeah.
It really is. You know, that whole SPLOST 8, SPLOST 9, and with SPLOST 9, it's a continuation of an existing.
Right. That's
It's been
right.
going on, what, 35 years? or something
39
30
years. 39 years.
And so we're just wanting to keep
And
that.
contrary to
funds coming.
opinion, we're actually on the lower side of sales tax, if you know, in the state of Georgia right now. So over 2/3 of Georgia's counties are actually at 8%.
Yeah.
And we're at 7.
Yeah.
And you know, SPLOST 9 would keep us at 7. So. Yeah, I think a lot of people may be getting confused from that, but we're
Yeah.
actually
It's not a new one.
It's not a new one.
No.
You know, it's just a continuation.
So I think the big thing is, you know, we just want to remind everybody to vote.
That's right. Yeah,
And
please
just vote.
please get out, vote. That's it. So wrapping it out. I mean, that's the
Man, I
we're back where we
appreciate.
started pretty much.
Yeah.
Environmental health side of things, and this takes you out to the lobby, and
Well, I appreciate the tour, man.
pretty nice
It's,
facility. So
It is. You know, it's got everything. It's
looking forward to
awesome
welcoming the community and DPH into their new building, and can't wait to cut the ribbon on this with their staff. So it's
It's gonna be a good thing.
be pretty
It's
awesome.
a good day.
Yep.